Hey everyone, this is Dave with Valor Fire Training. Just like everyone else, we've been trying to find our new normal with this COVID-19 response, and it's been difficult to say the least. I talk to multiple people around the country every week, and I've been hearing stories of stress and anxiety. And unfortunately, at the beginning of this, a lot of our concern was that the added stress on top of what we already do was going to become too much for some people. And we've seen that start to become a reality. We've seen an uptick in mental health crisis. We've seen an uptick in first responder suicides. And so I wanted to put a video out there with some resources for anyone who is feeling anxious or having issues dealing with some of the stressors that we have to deal with on a daily basis. So first off, I want to tell you that you're not alone and that we are all in this together. I myself have been pretty open in a couple interviews over the last month or two about my own struggles with anxiety and fear. And when this whole thing first started, I had a friend who was working in the containment type setting for COVID patients. And so I got to hear a lot about the emerging trends of the patients and some of the things that were coming out as far as the research. And it was really interesting, but at the same time, it was extremely scary to me that this was a novel virus. We didn't know a lot about it. There were a lot of questions that I would normally have answers to for a lot of other things that we didn't have answers to, like, is it truly airborne? Can I contract it if I have an open wound? All those things that we really kind of take for granted because we know a lot about body substance isolation and wearing the right PPE. This thing, we didn't really know. We had an idea, but we weren't 100% sure. And so looking at the treatment modalities and looking at kind of some of the things as a paramedic, it was interesting. But as a first responder, it was extremely scary to me. Within the first couple of weeks, we realized that we didn't have enough personal protective equipment, just like a lot of other agencies. And so when you go to try to order that stuff and it's all back ordered and you find out that it's not going to be there for months, that added some stress. And then socioeconomically, as we watched the whole country basically shut down, when I got off of work and came home, my children, my two sons and my wife were here and they were stressed. And so that added a little bit more stress to my life. And so right around the time that they started going from containment to mitigation, I kind of had a meltdown. And I was sitting in my living room one day. I had heard some preliminary numbers from some research about the numbers of infected and the number of deaths. And when I originally heard it, it was somewhere in the neighborhood of like 96 million people were going to be infected and 1 million people were going to die. And I remember saying to myself, well, that's crazy, but that's worldwide. That's a lot. But if you extrapolate that out over the whole entire world, it's really not. And then I found out that that was not for the world. That was just for the United States. And that number was really hard for me to wrap my head around. And so what I've told a lot of people is that it wasn't necessarily fearful of the virus itself. I was just completely overwhelmed with all of the input that was coming in. I had to deal with how to teach my kids school at home. I had to deal with the fact that we didn't have enough personal protective equipment. I had to deal with the fact that, they're saying that our hospital systems are going to be overwhelmed and that our EMS resources are going to be overwhelmed. And so all of those things kind of combined put me into a complete panic. I was having chest pain. I was having shortness of breath. I was having the racing heart. I didn't sleep for probably 3 or 4 days. And I thought I was doing a really good job at hiding it. And I found out at work that I was not. I was pulled into the office by my deputy chief, who said that my crew was worried about me. And they said that they had seen a change in my behavior. And so he asked me if everything was okay. And I tried to tell him that it was, but I think he knew that it wasn't. And so because he kind of pressured me into talking to him, I don't want to say pressured. He didn't pressure me. He opened the door for me to talk to him. I did. I had a little meltdown at work, and I cried. And I told him that I wasn't scared of the virus. I was scared of everything else that was going on, and that I was having a lot of anxiety. So we discussed a lot of things. We talked for a while. He was very supportive. He knew that, this wasn't a long-term thing. This was a very finite because of this situation. But he recommended that I talk to someone. I got set up with a therapist whose spouse is in law enforcement, so they understand kind of the public safety realm of things. And I've also been very open about the fact that I got on medication. I started taking clonazepam, and I only took it when I was having anxiety attacks, probably a few times a week. I would take one and it would help get me through. And so over the last month, I've kind of come to terms with everything that was going on. I've learned how to deal with it. I reached out to some other friends who guided me down the path of meditation and outdoor activities. I was already working out, but I tried to step that up a little bit to try and kind of get my mind in the right place. So through working with the therapist, through the medication, and through all the other things that I was doing for self-help, I was able to kind of turn around some of those issues that I was having. But I also understand that some people aren't able to do those things. Depending on the area that you're at, you're getting hit harder with COVID, and there's more restrictions on where you can go and what you can do. So I wanted to put some resources out there for everyone watching. I've said for years that anybody who follows Valor Fire Training is part of our family. And so as such, I want to make sure that you guys have the resources that you need. So first off, there is a company called Rung. They are a group of peer support specialists that are all fire and EMS based. So when you call, you're talking to your peers. They may not be from your area, but you're talking to other firefighters, paramedics, EMTs, and they will give you peer support and talk with you. And if they feel like you need more help, they will help set you up with a clinical therapist so they can actually get you medical resources and kind of help guide you down that way. Great company. It's been around for a long time. They've been doing great things. I actually met them at FDIC and had a good long talk with them. I think they're doing great things, and now more than ever, it's paramount for people like that to be doing what they're doing. If you're an IAFF member in the union, you and your family are qualified for the International Association of Firefighters Centers for Excellence. So it is a brick and mortar building, but they also have a number that I'm going to put down in the description. You can call and you and your family qualify for help. There are counselors that you can talk to. There are therapists that they can help set you up with. And if need be, they can get you to a brick and mortar building for inpatient therapy. Obviously, there's the National Suicide Hotline. If you or anyone you know is feeling like they want to harm themselves, you can call that number and talk to someone immediately. That number's there 24/7, 365, just like the others. And that is a great resource. Also, some of the things that are available depending on where you work, there's employee assistance programs that you can go through with your city. And some departments have their own mental health specialists. So please reach out. The other thing, and I kind of wanted to touch base with the people who maybe aren't necessarily struggling. When I had my issues, my crew was great in helping me identify my issues and being very supportive. And I've watched over the last month as they individually have all kind of had their freak out moments. So even though they weren't freaking out when I was, down the road, they kind of all hit their point where they were overwhelmed or they had finally kind of processed what was going on. And so we have all taken turns looking out for each other. So every day you go to work, if you go to your volunteer station and you're doing truck checks or you're at a meeting or something, look out for everyone else. If somebody's not acting normal or you normally talk to them a couple times a week and you haven't heard from them for a while, reach out to them because they may be struggling and just don't want to talk about it. And the last thing that I wanted to talk about real quick was the bosses out there. I am a captain and a medical officer, so I run an ALS medical program for my volunteer department. And I also am a full-time career firefighter paramedic. So I've gotten to be the boss during this, and I've gotten to be the firefighter paramedic and be looking at how my bosses are handling this. And overall, I think that, here in Kansas City, we haven't been getting hit as hard as other areas. And that's just by luck, I think. But we have definitely had COVID patients. I mean, I've transported COVID patients, and some of them have died. And so with that being said, it is super frustrating for us as employees to have things change every other day. I understand that there's new research that comes out, there's new guidance that comes out, and that's understandable. But when we sit there and look at the fact that I come into work on Monday and I have to wear an N95 mask, and then on Wednesday I'm told that I can just wear a surgical mask, but then by Friday we're talking about wearing PAPRs or wearing an SCBA. All those things are stressors, and I know from sitting in an office that we can make those changes with the whip of a pencil, but we have to think about how that's going to affect our employees. There is a lot of fear going on right now as far as the virus itself. Am I going to take it home to my family? But there's also stressors with longevity. I mean, what's going to happen with fire department budgets? There's already been talks of layoffs. And even within my own department, there's a lot of people that are concerned about the budgetary stability of our department and what's going to happen next year or the year after with budget shortfalls. So when we're changing things up and we're doing things, that can add stress. So just be mindful of that with your employees when you're changing things. That if it goes a long way if you can explain why. If you can tell them why we're changing things, hey, here's the new guidance that just came out, this is why we're changing it. It gives them a little bit of information so that they can kind of help process why those things are changing. By and large, my departments have done a really great job, I think, of trying to deal with this. And I've talked to other people around the country who are really appreciative of their command staff and what they're doing. But I've talked to just as many who have lost faith in some of their leadership because there's just no communication. They don't know why they're changing things. Things are changing day to day. And they feel like they're not changing them for the best interest of the people. They're changing it because of budgetary reasons or, PR things. So again, if you're a boss, think about your people, think about making sure that they're doing okay. Something as simple as just checking in with them. I try to call everybody on my department just to check in real quick and see how they're doing. So I haven't gotten around to everybody, but I try to make sure that I touch base with the people who maybe I haven't heard from. But look out for yourself, look out for your crew, look out for your family, and just remember that we are all going to get through this together and that you are not alone. Again, I'm going to put the description down in the description. I'm going to put the phone numbers and links for Next Rung, the International Association of Firefighters Center for Excellence, the National Suicide Hotline, and a couple other resources that you can use if you or anyone that you know needs them. We're looking forward to getting back into training once this whole thing is a little bit more under control. But until then, if you need anything, reach out to us on Facebook, Instagram, Twitter, or you can email me at david@valorfiretraining.com. Take care, be safe, wash your hands, and we'll talk to you soon.